The first weeks after ACL surgery are absolutely vital. In this video, I'll be covering some of the things that you should prioritize in week 2, how to keep your knee straight, how to properly use crutches, how to wake up your quad muscle, and how to avoid setbacks that can delay our recovery. At the end, we will review a full week 2 ACL recovery checklist. One major mistake people make in the early weeks is not keeping your knees straight enough. You want to achieve and maintain full extension, or you'll struggle with stiffness later on. If your knee is bent all the time, scar tissue will set in that way, and trust me, regaining extension later is much more difficult and can be more painful. So the goal, keep your knee as straight as possible when you're resting. Walking with crutches seems simple, but I see people using them wrong all the time. And that can mess up your balance, your gait, and put some extra stress on your knee. Without getting too deep into the biomechanics of it all, when we're using a single crutch or a single cane, we actually want to use it on the opposite side of the injured side. This may seem counterintuitive, and trust me, I know it feels weird using the crutch on the opposite side, but in the end, it actually improves functionality and reduces joint stress and makes it easier to transition back to walking. After surgery, your quadriceps muscle is going to feel asleep. This is called quad inhibition. And if you don't wake up that muscle early, we could struggle with movements later. An excellent tool to help out with this is neuromuscular electrical stimulation, or NMES. NMES is different than TENS, which is transcutaneous electrical stimulation, and that's typically for pain relief and sensation. Neuromuscular electrical stimulation actually causes the muscle to contract, which is exactly what we need in the early stages of recovery. Because every E-stim unit is a little different, it's important that you ask your physical therapist how to properly use yours if you're using it at home. But typically, this is how we would do it. You're going to position the electrodes on your quadriceps muscles. You're going to set the intensity as high as you can tolerate because we want to see if we can get the intensity to the level where we can see an actual contraction happening. And then when the machine turns on and our quad is contracting, we want to contract along with the electrical stimulation and do it on our own as hard as we can as well. Combining electrical stimulation with quad sets and straight leg raises helps activate our quads much easier and really improves early activation. This isn't just about strength, it's about neuromuscular control and activation. The sooner we can get your quad firing again, the sooner we can support ourselves while we're standing or while we're walking. We also still can't ignore swelling and pain management. Too much swelling can slow everything down. Don't just toss one pillow under your knee and call it a day. Elevate your entire leg with your knee slightly above your heart for the best results. Ideally, we also want our heel propped up so our leg remains straight. So here's our week 2 ACL priority checklist. Maintain full extension using heel props and quad sets. Use crutches properly using the assisted device on the opposite side of the involved leg. Wake up your quad with electrical stimulation and activation drills. Manage your swelling with elevation, ice, and compression. And then stick to your post-op guidelines. Do not push past your limits too soon or outside of the bounds of what your surgeon gave you. All right, and that sums it up for week 2. As always, thanks for watching. Be sure to subscribe if you want to follow along, and I will plan to see you next week. Thanks.